Hello, my name is Ashley, and today I'll be discussing the Affordable Care Act, but more specifically, its influence on long-term healthcare policy and primary prevention in the United States. Okay. We're just going to slide right into it with the key elements of long-term care. The ACA had introduced several important components for long-term care. First, it was the incentive program that continued supporting institutional care models, which was instrumental to our second point, which was Medicaid expansion, which had increased the eligibility and had allowed for more lower income adults to qualify for these long-term services. And thirdly, that states gained more flexibility in offering homes and community-based long-term service care options, also known as the HCBS. These reforms had, of course, lasting effects, with the long-term effects of healthcare access and delivery. With more lower income adults being able to access these HCBS services rather than just being limited to the nursing facilities, states had began increasing their home care options and expanding patient choices, which was a great step. However, financing stability still remained inconsistent because their funding and implementation strategies were still heavily state dependent. Moving on to our empirical evidence from scholarly sources, um, my research shows that clear increases in the use of long-term care services with adults who became newly eligible under Medicaid expansions. We see that those improved overall utilizations of long-term care happens as more individuals qualified through the expanded Medicare criteria, meaning their services were accessed more consistently by lower income populations. And as well as the policy contributed to measurable increases in the availability of home and community-based services, or the also known as the HCBS as mentioned, giving these patients just more options outside of the institutional facilities. Therefore, I support the ACA, but not fully the LTC reform. This is really because I saw major reductions in the uninsured rates, which has expanded access to care. The policy also expanded patient choice, especially with institutional versus community-based care. But what really stood out to me was that the ACA did not introduce universal long-term care reform, which I thought was important, or nationally guaranteed coverage, meaning that it created a new option and it had stopped short of completely reforming the long-term care access and financing across all the states, which again, I thought was crucial. So, to address those gaps, two improvements for the future health system would focus on two areas. I thought it would be increasing the federal funding stability for home-based and long-term care programs that ultimately reduces our state dependency, as well as raising national standards for long-term care programs so that access isn't just determined by location or, the state incomes. All right, moving on to primary care and primary prevention under the ACA. We see in the chapter one of the essentials of the U.S. healthcare systems for the key elements of primary care, the ACA had dramatically increased insurance coverage starting in the 2014, which had roughly millions of newly insured adults seeking outpatient care that had also expanded the primary prevention through preventative visits. Sorry, I apologize, visits with no out-of-pocket costs, which was great, and increased federal funding for federally qualified health centers that helped with supporting the rising patient demands. All right. For the long term effects with empirical evidence. The evidence from the scholarly sources that I found shows that insurance expansion had led to a more clear increase in primary care outpatient visits, which was great. We also saw that rising preventative care utilization across some new patient populations, which was very crucial. But of course, the primary care physician shortage worsened due to their capacity limits, proving that insurance reform had succeeded faster than the workforce growth could have kept up with. With that being said, I do support these prevention-driven improvements, but again, with certain limitations. I the reduced uninsured population absolutely should mean more access to primary care. With the increase of preventative visits, this demonstrates an improved early disease detection and health maintenance. So, although that although the ACA had created the LTC options, which was awesome, it did not build a universal long-term healthcare system and the primary care still unfortunately faces major workforce shortages moving forward. To wrap things up, here are two system improvements. I think to truly improve the US systems in a long-term viewpoint, we have to strengthen our delivery. So for one, making the HCBS funding stronger and more consistent at a federal level instead of it just annually fluctuating and being state controlled, as well as expanding the primary care workforce and restructure of the Medicaid CPC reimbursement pay so that primary care becomes a sustainable path for future clients. And here is all my references. Thank you so much.